Good morning, everybody. We'll just give one more minute for everybody to trickle into from the waiting room. Staff, are you able to take the agenda off the screen so I can see everybody that's in the room on one page as we just introduce? And then that'll be a little easier to catch everybody. Great. There's a couple more people trickling in. All right, good morning. It is Friday, June 27th, 2025. It is 8:30 a.m. This is the Oregon Veterinary Medical Examining Board's public session. Thank you for joining us today. The public session is starting at 8:30. We'll continue to the end of business. Executive session was held yesterday and came back into public session for voting reasons. We'll continue the end of the business today, and then we will not be moving into executive session after this meeting since the public session and the executive session had switched spots. And we did the full executive yesterday. So I'll do a quick roll call. If you could just say here when I call your name. Dr. Reagan Borzek.
Here.
Thank you. Dr. Allison Lamb is here. CVT Natalie Mayer Williamson.
Here.
Thank you. Public member Karen Pate.
Here.
Thank you. Public member Brian Wadika.
Here.
Thank you. Board members that are absent are Dr. Brett Hamilton, Dr. Katie Wallace, and Dr. Max Rinaldi. Executive Director Peter Burns.
Here.
Thank you. Investigator Janine Holland.
Here.
Investigator Bertina Graho.
Here.
Thank you. Licensing Administrator Brooke Walker.
Here.
Thank you. And Senior Assistant Attorney General Joanna Tucker Davis.
Here.
Absent today is Inspector Ingrid Nye. Thank you. That concludes our roll call for this morning. I thank everybody for being here. We do have some public members in the room. I will go around and just do a quick introduction of all the public members. We'll just ask that you keep it just to your name and that you're a public person just attending the meeting today, or if you have a title for an organization that you represent. We'll start with Glenn Cole.
Yes, I'm here, Glenn, with the Oregon Veterinary Medical Association.
Thank you. Dr. Ryan Schultz.
Yeah, good morning, Ryan Schultz, State Veterinarian with the Department of Agriculture.
Great, thank you for joining us. Julia Villarreal.
Hi, I'm Julie Villarreal. I just have an open investigation currently.
Thank you. And I apologize if I butcher names on here. I have a C. Labriola.
Carolyn Labriola, public member.
Thank you. Jamie.
Jamie Cheshire. I'm a board director at PBMA and public member.
Thank you for joining us today. Chantal.
I am a CVT and a board member of OVTAA.
Thank you for joining us today. And Alyssa.
Hi, I'm just a public member listening in.
Thank you. I believe I missed Scott Young.
Hello, just public member. I do pharmacy and veterinary policy.
Thank you. Oh, one more person. Sorry, everybody's moving around my screen. Cindy Guam.
Yeah, my name is Cindy and I'm a fourth-year pharmacy student.
Great. Thank you very much for joining us today, all the public people. And we can move forward into public comment. This is limited to 3 to 5 minutes. And I do think we have one agenda public comment information. Does anybody that's attending today want to make a public comment? It is limited to 3 to 5 minutes since it's not on the agenda. Okay, I think it's just that one, Director Burns, if you would like to introduce that one.
Yeah, thanks, Dr. Lamb. And Brooke, if you could bring up the documents on the screen share, just so folks can see those. Okay. So here we have an email from Dr. Janine Wilson from the Oregon Equine Incorporated. It's related to animal chiropractic. This is here for the board to review. The board can look at this and direct staff if they determine to do so. This is related to a later topic we're going to discuss in allied health and alternative treatment. We're getting a lot of calls on these topics from various stakeholders in these fields. So I think it's time we look more closely at this. We'll talk a little bit about some of the things we're doing to try to get information out to stakeholders later on in our discussion and action items. But I just want to put this before the board for their consideration. The board can look at this and email me later and say we'd like this on an agenda for discussion, action items, further discussion, ideas, workshops, work groups, whatever the board feels is necessary.
Any board members have any questions for Director Burns at this time regarding this public comment or anything that they'd like to share? All right, we can move off of public comment, which is item number 4, and move into approving the agenda. We have today's agenda. Any board members with any concerns with today's agenda? Any concerns with the meetings from last meeting from April 10th and 11th of 2025? If there's no concerns, I move to approve today's agenda and the public board meeting minutes from last meeting. Do I have a second?
I'll second.
Natalie seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Brian? Dr. Lamb? Aye. Motion passes to approve the agenda and the minutes. I believe we're on to item 6, which is an update from our state veterinarian, Dr. Ryan Schultz.
Good morning. Thanks for having me as usual. Just a few things to update, and I apologize. I am about 30 seconds out from parking. So if I seem like I'm not paying attention, it's because I'm not entirely. We have been busy working on quite a few projects related to diseases and disasters. We have not had any new cases of avian influenza since March. We do anticipate seeing more cases this year, though. We know that that H5 is still in the wild population, just the migrations, the way that they run, we don't tend to see cases in the spring. So we are gearing up for that. We have received a couple of grants, though, in the last couple of months to do some different projects related to that. One is we have a grant that will be beginning here probably late summer to begin kind of revamping our disease reporting, how all of the diseases that get reported to us get displayed online, getting a dashboard up there that can show all of the cases that are being both reported and our monitored cases coming out of labs. Have a real-time dashboard on there to be able to show all of those in near real time, probably within 24 hours of report. And as well as doing quite a bit of outreach on what diseases are reportable, how to report them, and hopefully streamlining that process. We also are beginning a grant here next week that work with a couple of OSU students, one vet student, one animal science student, that will be doing outreach to producers, primarily dairy producers, for this summer, working with them on doing biosecurity audits and helping them develop stronger biosecurity plans. That will be a 3-year project, so we'll run over the next 3 summers with OSU students. We also received a fairly sizable allocation through the Department of Emergency Management from the legislature to put together some disaster stockpiling supplies. So we have 32 shelter kits that are being built right now that will be distributed between those and the 4 shelter trailers we already have. We will have enough to place 1 shelter stockpile in each county throughout the state. So those are designed for 20 companion animals or 20 stalls or pens of livestock. There's both separate that go together as a kit, as well as several larger trailers full of larger panels for dogs that need to be in larger kennels or small ruminants, other species that need to be in 5x5 kennels. So those are all in process. We hope to have them all put together here in the next couple of weeks and ready for deployment out throughout the state. We are also working quite a bit this summer. We have another communications intern working with us, doing quite a few different projects related to some templates for use in disaster response. So for counties to be able to kind of communicate out some of the animal specific information in disasters, for sheltering, for evacuation, for some of the longer term impacts. We actually had the opportunity to work with Dr. Burns Dr. Katie this winter when we were seeing flooding out there in Harney County, and develop a few of those resources, but hoping to proactively develop a bunch of those resources this summer, as well as some disease related resources to go with our disease reporting grant. So busy time with Department of Ag. Fairs are starting up as well. We do have the same requirements on fairs this summer as we did last year, that dairy cattle and waterfowl, the two species that are capable of carrying influenza asymptomatically, that they will be required to be tested unless they are participating in pre-existing surveillance, which about 90% of the dairies throughout the state are already doing surveillance with us. So we don't anticipate nearly the number of animals being tested just to go to fair this summer. But we are working through that with the counties as well. So I think with that, probably the end of my update, unless there's any questions.
Any questions from board members for Dr. Ryan Schultz? All right, well, thank you so much for taking time out of your busy schedule while you were driving to join us today.
Thanks, Dr. Schultz.
All right, we'll move on to item 7, which is a legislative update from the OVMA president, Glenn Kolb.
Thanks, Dr. Lamb. I am not driving, so that's a good thing. This could be shorter than my previous updates for you. The legislative session is narrowed and it's winding down. It should end no later than Sunday, which is a good thing. A couple bills that we have tracked and worked on quite a bit. One is a bill for funding for the Oregon Veterinary Diagnostic Lab of about $3.5 million. That was part of the very first bill heard this session. And we learned yesterday that there has been inclusion in higher ed's budget, and it has been approved by the legislature and going to the governor for her signature. So that's very positive for ongoing services through the diagnostic lab at Oregon State University. Initially in that bill, there was a $10 million request for the Carlson College of Veterinary Medicine. That was amended out of the bill early on in the session. There was just a concern that the $10 million was too big of an ask for a state at this time that has some budget concerns. So that will not move and did not move forward. But the bill for the OVDL inclusion in higher ed's budget did. Senate Bill 976B is another one we worked on quite a bit through the session. It did pass the House yesterday, was approved in the Senate previously. What this bill does is allows for lay, unlicensed people to provide verification pregnancy services for cattle in the state of Oregon. The original bill also included allowance for lay people to provide equine dental care with no oversight or supervision. We opposed that part of the bill. We actually have opposed the bill entirely. And that part, in equine specific, was amended out of the bill by the sponsor, who's a cattle producer in Eastern Oregon. Our guesses and presumption is that if that had been included, that bill would not have moved forward. So he amended that out of the bill, and pregnancy verification for lay people is included. That's been adopted. The next step is that the Oregon Department of Agriculture will write rules as to how can these people be verified and qualified to provide those services. So we'll wait and see. There's some other House bills under consideration. Most are not going to move, but they're still not dead yet. One is House Bill 3314A, which allocates roughly $1 million in funds to study mitigation of for efforts on algal blooms, algae blooms. And so why would we be interested in that particular bill? This is specific to Ross Island in the Portland area, but I think if you're a veterinarian and technician in clinical practice, you may have had patients come in that have been affected by algae blooms, very toxic to people and dogs mostly. And so our hope is that any mitigation efforts, any learning about more mitigation efforts then could be shared with others around the state, because we know there at any time there are notices of algae bloom concerns in waterways across the state. The bill's in the Joint Ways and Means Committee. It has not gone to a subcommittee of Ways and Means, which kind of indicates to us that it is not going to move forward, but officially it's still active. House Bill 3871A establishes an animal welfare trust with oversight by Oregon Department of Agriculture. That's kind of just the administrating body. And it would provide grants to entities, including veterinary clinics that provide veterinary support services related to animals in low-income households or underserved communities. The OVMA has supported this. We think it's important. However, this bill also has been referred to Ways and Means, has not been scheduled for a subcommittee hearing, so it's unlikely that it's going to move forward. A couple Senate bills would be Senate Bill 181A, still under consideration. That would prohibit a research facility from using public funds to directly fund medically unnecessary lab research on dogs or cats that is classified under certain pain and distress categories. So what does that really mean? I think, the Senate approved the bill, but however, when it went to the House, there's been discussion, and the Carlson College of Veterinary Medicine has raised some concerns with the specific language that the definitions of veterinary research and the definitions of veterinary education are very narrow and is not accurate. Their concern is that potentially it could impede the education and training of students. So the OSU's lobbyist, acting on behalf of the veterinary program, has been asked and directed to meet with supporters of the bill to see if they can come up with some language, some agreement on language for those definitions. As of this week, they have not, as we've learned, so it's unlikely that that bill will move forward. And then one last bill I'll mention is Senate Bill 1076A. It establishes licensing fees for animal rescue entities, including shelters, and also breeders, and directs Oregon Department of Agriculture, Animal Health to adopt rules for compliance, inspections, and care standards for rescues entities, but also breeders. This has been in place for rescue entities for quite some time, but it has not included breeders of cats, dogs, and birds. This bill, because of the fiscal impact for ODA, probably is not going to move forward. It's been referred also to Ways and Means, and there has not been further discussion on that. So that's in all likelihood, with a day, 2 days left in the session, that's not going to move forward. And then what I'll do is I'll share this and provide a written report to Pete, so you have that for your records.
Great. Thank you so much, Glenn, with OVMA. It's really helpful to get this information to the board through your organization. We really do appreciate it.
Thanks, Dr. Lamb.
I'd like to just extend that appreciation, Glenn. It's been a whirlwind legislative session, and these hearings have been scheduled and squeezed and moved around, and Glenn's just been fantastic in communicating that and just keeping our agency apprised to these changes. And it's just an incredible partnership. I really appreciate it, Glenn. So just echoing what Dr. Lamb said. Thank you so much.
Pete, you're welcome.
All right, that leads us to item number 8, which is the Executive Director Report with Director Pete Burns.
Great, thanks so much. Janine, can you put that up on the screen? Oh, you have, thank you. All right. Just a couple things I'd like to highlight. Our budget passed very recently for our agency and for other health-related licensing boards. Dr. Lamb and I were out presenting that earlier this year during the Joint Ways and Means Education Subcommittee. That our budget's gone through. It's a great relief when that happens. Anyway, a big step. So just a couple things I have our typical budget report here in the first part of this. I'm gonna get mine up because I can't see that too well. Just a second. Here we go. So in the first part of that, I have our typical budget numbers. These are all updated from May. We're in good standing. We've got our fee increase coming. I'll talk about that a little bit when I talk about rule status update. But we're good as we're coming up at the end of the fiscal year here. Everything's looking good financially. I just want to point out one thing. Everything here is pretty boilerplate. You've seen this. You also have the detailed budget documents on your iPads. If you looked at those and you have questions, I'll take those momentarily. But I want to point out in April, we received the accounts receivable honor roll certificate again. It's in a row. We've achieved that, and that just reflects really it's Brooke Walker who's doing that, and reflects her diligence, just staying on top of those reports, working and coordinate with DAS Shared Financial Services. So I just wanted to point out Brooke's continued excellence in managing those accounts. The other thing I want to point out down here is under budget related. So in January 2025, we had $23,200 in unpaid or unaccounted civil penalties. We've been working away at those, and in May, we reduced that to $5,250. Now, the majority of that was either recouped unpaid civil penalties or civil penalties that we were able to confirm had already been paid and just weren't accounted for properly. So we cleaned the books on those. We've got this remaining $5,250 in civil penalties, and these are in process of either being recouped or processed through Department of Revenue for collections. And if they can't get those through collections, then they'll be written off, but it'll clear our books up a little bit. So making some advance there, with just kind of fine tuning our budget and making sure we know this money and revenue is properly accounted for. Other than that, we've got just some things that have been on the executive director's report for a while. Board member recruitment is ongoing. I've been talking about this last couple board meetings and broadcasting this far and wide. We're starting to get some applicants coming in, some people reaching out to me to express some interest, and so that's fantastic. As this states, we're looking most immediately for a public board member, but we do have some veterinary seats coming up in early 2026 too. So we got to start preparing for that. There's things we need to do before those seats are vacant. So we're working on that. We've got some people reaching out with interest. So fantastic. I appreciate everybody helping get the word out on that. Moving down to just a real quick review of our agency program areas: licensing, compliance, and facility inspections. Licensing, we have our same numbers from April, not a lot. So our licensing numbers are here. We'll have those updated in August, but they shouldn't change too much. Investigations, I do want to point out one thing I've been highlighting the last couple meetings, and these numbers just keep getting better. So I want to highlight the hard work of our investigators. It's the last line here in this first paragraph. We currently have 9 cases that are more than a year old, down from 16 at the last board meeting and 36 a year ago. So that number just keeps getting smaller. These last few outliers are old cases that are at hearing. They're just in some complicated form of process, but we're clearing them up, and I'm just real pleased that this number's come down from. These are older cases, and we don't want those cases, dragging out too long. We want to wrap them up in a timely manner, and that's what we've been doing. The investigator's been doing a great job. The board's been doing a great job of clearing these cases quickly too, reviewing them carefully, giving them their due diligence, and then wrapping them up and moving them on. That's what licensees want. That's what complainants want. It's good for the public as well. So great job to our investigators. Inspections. Right now, our facility inspector is on leave. Inspections are on hold right now. The staff is working to plan for that in the interim. We're expecting our inspector to come back. In early July and get back on track with those. So I'll have more to update in August on that. That is the executive director's report. I'll open it up to questions, comments.
Any board members with questions or comments for Director Burns regarding the director report or financial information? All right, looks like we don't have any comments. I did want to echo the appreciation for staff as well as you, Director Burns, in regards to moving these cases through. I think this board has experienced an unprecedented number of cases in the last few years, as well as, had a lot of new staff members a few years back. And I feel like exponentially, the team has started to just thrive exponentially and started to just move everything through. And it's fun to watch. It's exciting for the board members to get to do those cases. And not that we want to see more cases, but the board members do enjoy working through those cases and giving them the due diligence they need. And I do want to thank the board members for taking that time on every case to really consider the public need for protection in this organization. So thank you. And if there's any public members or veterinarians out there or CVTs, we're definitely always looking for people to join the board. So don't shy away and reach out to Director Burns if you have questions about the position. All right, that leads us to item number 9, the discussion and action items. And the first item under there is the public meeting review with Director Burns.
Okay, great, thanks. This is in your board packets. There are a couple little items in there. These are from, these are a couple, I don't know if Brooke can throw those up on there. Oh, you did, great. Thank you so much. So these are provided by the Oregon Government Ethics Commission. There's been a lot of rule changes lately related to public meetings. And so they put these handy checklists out. So I provided them to you. At this point, I'd just like you to take a look at them. Maybe you already have, or you need some time. But it's just a checklist for public meetings, executive session, and you can look through this and see, are these things we're doing? Are there any items that we're missing, or maybe we could do better? If you see those, reach out to me, let me know. What I'd like to do in August is invite OGEC, the Ethics Commission, to come out and they do some trainings, and they can kind of do a deeper dive on public law. We could review our checklist together and see, what we're doing right and where we might be able to improve a little bit. With Dr. Lamb's leadership, we've really looked at these closely, and we've kind of formalized our process a little bit more. And I think we're meeting all these marks pretty well. More information on that, but I think in August we'll have someone from OGEC here just to kind of maybe review this with us and go through some of the presentations or some of the detailed trainings that they have. Any questions on these or any comments right now?
Any board members with questions or comments? I think this outlines how complicated a meeting can get with all the steps. So take a look at it, board members, and let us know if there's anything that we would like to include.
It's not easy making it look as smooth as Dr. Lamb does. And, we meet regularly, we put a lot of work into that. She puts a lot of work into that and has put a lot of focus in a lot of the things that we needed to fine tune. So I'm grateful for that.
Thank you. Couldn't do it without the staff behind us for sure. 100%. So we'll move on to number 9.2. This is the CVT work group update. This is again with Director Burns.
Okay. This is just a verbal update. There's no documents here. I just wanted to say the CVT work group met in April, and we're looking for new dates for the second week of July. And so I'll have more to report on this in August. But Natalie Mayer Williamson, our esteemed CVT board member, is the chair of that work group. So I don't want to, I'd be amiss if I didn't give her the opportunity to say something about the April meeting. From my take, I know that we've reviewed a lot of the rules, looking at making some suggestions and or maybe some recommended changes, and then or some policy changes, and then reviewing that again at this July meeting. But Natalie, did you have anything else you wanted to add on those?
Just that the group is really informative and they're very, generous with their time and their suggestions, and I think it's been going well.
Thank you so much. It's great work. It is a robust team. So more to report on that in August.
Great, thank you. And thank you for your leadership, Natalie, on that work group and all of the people that have come together to work together to give ideas to that work group. I know there's a large amount of people that are contributing to our work groups these days, and I really appreciate the public interest in that. So we'll move down to item 9.3. This is continuing education. We had some conversation last month about antibiotic and pain management, and this is being brought back to this meeting for an agenda item.
Thank you. And this again is just a verbal update here. At the last board meeting, the board asked that I send out a survey to licensees. And to be honest, it's just been a heck of a couple months, and this has not gotten done. But I've discussed this with Dr. Lamb, and she's going to help prepare this survey to make sure we get the right data points, the right questions asked. So this is in process, and I expect by August we'll be able to bring back something, an update saying at least the survey's gone out, or maybe we're starting to get some preliminary information back too.
Great, thanks, Director Burns. In that, were we also reaching out to the other boards to see what they were doing? Was this item as well?
Correct, yeah, you reached out to other jurisdictions, and AAVSB is always a terrific partner in getting that data in.
And for those that do not know or not familiar, since we have a lot of public members on the meeting today, or public individuals, I should say, on the meeting today, you can become a public member. Just reach out to Director Burns. The AAVSB is a national organization that is comprised of all of the boards of the United States, as well as Canada and Puerto Rico. And there are a great wealth of resources of how veterinary medicine is regulated across North America. So it's just another organization we can tap into when we need to.
Thanks, Dr. Lamb. Yeah, I don't want to get stuck in our jargon and our acronyms. Thank you for that overview.
Yes. Are we on 9.4 VCPR discussion? And this is again with Director Burns.
Yeah. VCPR. So there's some documents here to review. Brooke has them up on the screen. You have them on your iPads. We have 3 VCPR related items for the board to consider. The first is related to educational institutions. And this is provided. Brooke, can you scroll down to the bottom of these, I think. One from the Humane Society. So, sorry. VCPR inquiry document, yeah, from Dr. Coaches. So the first one to consider is an email from Dr. Coaches from Oregon Humane Society. And we provided this at the April board meeting, but we did want to have a little bit more discussion on it. So it's here for introduction, discussion. And Dr. Lamb, did you have any more you wanted to introduce on this topic?
No, I think it was just something that came up in another discussion that just needed to be revisited and closed or further discussion. And I think we're going to bring that back at the August meeting for a full, robust discussion with all the members. Is that correct, Director Burns?
That's right. I mean, I think for now it's just a review of this to make sure everybody has this on their radar, and then when we're back together as a full board, we can get more into this.
The goal is just to present the information for board members to deliberate on and think about between now and August.
And the same for the herd health document, which is what you had up there originally, Brooke. I think it's up at the top then. Sorry, went out of order. Same for this topic. VCPR's impact on herds. And again, this is just a kind of a reintroduction of this, so that we can discuss it more in detail in August.
And for the board members, these were all sort of things that
leave that there for you, and then go ahead. Sorry.
Sorry. These are all things that kind of came out of the discussion from the VCPR work group as kind of offshoots that didn't quite fit what we were considering that they were bringing to the table, but were conversations that sort of happened in tangent with the VCPR work group conversation. So we just didn't want to let them go unnoticed or undiscussed by the board without a final resolution or a final decision.
So are we not discussing these today? We're just doing this in August.
That's correct. We're going to discuss them with the full group of board members. So you can read through these and think about them between now and August.
And if any board members have input they'd like to share between now and then, you can send that to me. I'll compile it. We'll have it presented together in August. Just be wary not to have any, internal board meeting discussions on it. But if you have some input or things you'd like to share, send that directly to me individually, and then I'll compile it for the group.
Director Burns, was there a third?
Yes.
Topic?
We did have a question about microchipping, and it's VCPR adjacent, so I thought we'd throw it in here. And this is something I think we can discuss or at least introduce. It's a question we received from Friends of Feline. A quick question for someone who they hope we can interpret the Practice Act. Can shelter staff, veterinary assistants, or CVTs implant a microchip in an owned animal without having a veterinary on site, but under supervision of our licensed DVM and without a VCPR? So the caveat here is, as we know, OVMEB does not have jurisdiction over shelters. However, there's a scope of practice question here at the heart of this. So I thought it might be good for discussion so we can respond appropriately to these questions and help provide guidance.
Any board members with questions or would like to discuss the microchip and the VCPR under the shelter situation, but it doesn't look like for shelter animals. Is that correct, Director Burns, in this conversation, that they're helping animals outside their shelter?
Correct. They come in, we've asked, we try to ask some clarifying questions if they're taking, if they're taking ownership of these animals. But we do get a lot of questions about what can be done in these shelter settings.
Dr. Borzek?
Sorry, I just need clarification. So these are our owned animals or they are not owned? Are they owned by the shelter or are they not owned by the shelter?
Well, that's what we try to determine from them. If they're owned, there's a clear answer, and if they're not owned, that changes the response. And some shelters say they take ownership, and some shelters say they don't want to take ownership, and so they're asking for guidance on how to do this if they're not taking ownership.
If they're not taking ownership. Okay. Thank you.
Natalie? Questions or comments? Karen?
No, no questions or comments.
I
Brian?
mean,
Oh, go ahead. Natalie.
can't CVTs do microchips on animals now? So why would that be added into this as a question?
This is Joanna Tucker Davis. I think they're asking if a CVT can do it with no supervision. Or at least no on-site supervision. And again, like Dr. Borzik said, one, if they own the animal, then they're exempt altogether. I have a question which you don't have to answer now, but is does microchipping constitute a surgical procedure? And if that's complicated, we don't have to answer that today.
So Joanna, I'm not sure we've defined microchipping of whether it's a surgery or not. And I know some states do say that microchipping is a surgery and then make an exemption for that to be done. I do remember that in our rules under CBT, when we are under duties that can't be performed by somebody who is unlicensed, while I've been on the board, we removed microchip back in like 2017. And then we still had it under direct supervision for a CBT, and we removed it there. And it's actually in the archives of that rule. But I don't know if we addressed the conversation of if a CVT is working at a veterinary facility and not on their own accord, not as a CVT with an entity, like with a facility, or, you know, under a facility, or in this case, under a shelter, if that should be included in a VCPR. So I think that might require some legal guidance from you in regards to how to walk that line if we're going to be getting more of these questions, which I think we are with you know, access to care. I think people are going to be utilizing shelters more often for microchipping, spay neuter, and I think knowing where the lines are would be very helpful, or where legally we should be addressing this.
So if the board would like, I can put that on the list of legal advice.
Let me finish out the group with Brian, because I didn't ask Brian yet his comments or concerns.
I don't have anything.
Thank you. Is there anybody that's opposed to Joanna going forward with legal advice or feel in favor of it?
Yeah, I think that would be a good idea because, I mean, you know, owners do their own microchipping, so I don't know why this would be, it would be good to get some legal advice.
Any other board members? I think too, Joanna, we might need to consider that microchips and permanent identification devices are used quite often in large animal too. And I believe that people who are not veterinarians or CVTs are often putting in permanent identification in like feedlots and other agriculture. So I don't know if that's something that we should consider along this guidance as well.
Well, so there's going to be a few questions here. One is the practice of veterinary medicine. If the person owns or their agent or employee is doing it, there's an exemption for that. So there's that piece of it. And then the question of if it is the practice of veterinary medicine, like what policy options do you have around that? So I'll look into it.
Great. Thank you so much for looking into that for us. All right, that moves us down to discussion and action items. 9.5 Allied Health and Alternative Treatments with Director Burns.
Okay, thank you. And yeah, this is again related to a topic we were talking about earlier. We had an FAQ on our website related to this, and physical therapy, chiropractic, massage therapy. We took it down because frankly, it was a little difficult to read. We were trying to clarify things, and I don't know if it was doing a good job at that. So we took that down. We're looking at that. We've talked about this a couple times with Joanna, and we have an outline for this that's a little bit more digestible and applicable to the current developments. There's just a lot going on with these new schools, these new programs, and then people just kind of not sure if they can practice in these fields, crossover between human medicine and application to animal medicine. So it's time that we get this FAQ, at least in an initial phase of getting some guidance out to people. So Joanna and I and Brooke have some outlines ready to go. We're gonna look at getting this developed and back on our website. I'd like to bring it back to the board in August and say, here's what we're looking at, get you guys to at least sign off on it. I don't think it's necessary, but it's always better to just have some board eyes on it and especially Karen's with her attention adjustable. So expect a draft for that in August. But I really think it's time for a larger discussion and maybe coordination with other health related with these other allied agencies in terms of a larger, more appropriate response to these programs and how they should be regulated or can be regulated, where jurisdiction lies, things like that. So stay tuned for more in August, but I think we're kind of at the point where we need to do more coordinating with other agencies and seeing what our role is, what's theirs, and moving forward in a more a broader view than just us answering questions and throwing it. We're referring people to them, they're referring people to us. We've got to coordinate this better. Any other thoughts on this right now?
Board members, additional information for Dr. Burns at this time, or questions, or what you'd like to see? Dr. Borzek?
I don't have any. I think it's appropriate that we start to look at these more closely, especially if staff is getting a lot of questions and we're getting public comment, and I think it's important.
Thank you. Natalie?
Nope, I think it's a good idea.
Great. Karen?
Yeah, I agree, and I'm happy to help with that.
Thank you, Karen. We always appreciate your editing skills. Brian?
Sounds good. Nothing to add.
Thank you. All right, that moves us to 9.6. This is the rulemaking update. I believe Director Burns, you'll take this in lieu of Inspector Nye today.
Correct, yeah. So things are in similar status from our April report. So after April, and you still have that document on your iPads, the status update sheet, and then this notice of proposed rulemaking. So after our April meeting, this rulemaking hearing took place on May 19th. Change and then 10 minor fixes. The rule change, the bigger one, was related to our fee increase. And so that's ready to go. And the fixes, they're detailed in this document. So you've all seen this, you've had a chance to look at it. This is good to go. Next steps will be just to go into the Secretary of State's interface, their portal, and implement these changes. So the bigger one, the one that was a more substantial change, they were all substantial enough that they had to be done through this process. But this is the biggest one, the one related to rules. So they're ready to go into effect, and we're working through that licensing. We are having an issue with our licensing database related to fees. That's one thing we have to fix before we can implement that fee increase. So we're going to go into Secretary of State's website, make those changes. So the rules will be changed. We want to coordinate that so we're actually ready to implement it in our licensing database. So technically we're set to do it anytime after July 1st, but I anticipate with the fix that we need in our licensing database, it may not take effect until September. that's at the outset. So if it'll go sooner, I'm definitely going to push for that. But budgetarily, we're fine with that timeline. But that's where rules are. That's the only big rule change that's going into effect now. On our status sheet, we have our other rules that are in process that are being reviewed. You know, DCPR or CVT work group, if they make some changes, that's on our list. Other things that are just kind of in those research and research stages, we'll bring those back to the board as as those move forward. But this is a snapshot of where we are right now. It's very similar to where we were in April, but this batch of rules is ready to go into effect.
Great, thank you for that update. We'll move down to discussion action item 9.7, and that's applicants with OVMEB's licensing administrator Brooke Walker.
No, our applicant was reviewed yesterday in executive session, will be voted on today in public.
Great, thank you for that update. I believe we voted last night though. And we took care of that. So sorry, I know we reversed the public and the executive. So our little cans talks are now a little backwards, but thank you very much for that update. And thank you for everything that you've done with applicants, because I know that that's a heavy load from December to March. So, and then they trickle in year round. So, all right. I believe that brings us down to item number 10, which is our next board meeting, which will be August 28th and 29th. We're potentially aiming to do this one in person. So those of you who are joining us virtually today, you're more than welcome to join in person as well. It will probably happen at the government building in Oregon. And unless there's a different venue that's selected before then, so just check emails and updates from the board. Director Burns, is there additional information today that you needed to address?
No, that's really it. A lot of our discussion action items have been pushed to August, so I'm really glad that we're going to be able to meet in person. Right now, the venue is the Portland State Office Building. With July right around the corner, I don't know if we'll have time to consider a different venue. We could for November potentially, but we'll do it here in Portland. We'll have hybrid options for folks that may not be able to make it in. They'll be able to Zoom in. We did that at our last in-person meeting, but with all these topics that are coming back, I think it'll be good to be in person. It's always a little bit more productive when we are in person. So yeah, I'm looking forward to that.
Yes, the technical aspect sometimes leads to challenges as well. So I like the in-person meetings for sure. All right, well, it is 9:22. It is Friday, June 27th, 2025. This is the Oregon Veterinary Medical Examining Board's public session. We are adjourning for the day. I appreciate everybody's participation today, and I hope you all have a great weekend. We'll see you in August.